Well, bed sores are, the medical term is decubitus ulcers. And so basically you're talking about pressure ulcers. And they're fairly common with any patient who is bedridden or not able to move around a good bit. And of course, you're going to see that more so with the elderly than perhaps a younger group of people. They're not always caused by negligence, but they certainly can be. And unfortunately, what we've seen in a lot of cases is that it's the understaffing of the nursing homes that leads to shortcuts being taken with care, and that's unfortunately a recipe for disaster when it comes to developing these types of injuries. The cause of bed sores is prolonged pressure on a body part, and particularly if somebody's not having their position shifted with a regular basis. You tend to see them on persons who are, again, bedridden or in a wheelchair. You can often see them with wheelchair-bound patients as well. And where they typically develop is any part of the body which is going to have that prolonged pressure. We see a lot on the buttocks. Some of the most severe bed sore injuries we've seen have been injuries that have developed on the buttocks, but you also see them on heels is another location. Elbows is another location, and even shoulders. So any part of that body where there's a bony protuberance that's kind of pressing down into the bed, that's where we tend to see them occur. There's a number of factors that can increase the risk for bed sores. Persons with diabetes are certainly at a much greater risk for developing these injuries. The elderly, just based on the nature of our skin as we get older, it gets less pliable. It's more subject to this type of injury. So with the elderly, that alone is a risk factor. But again, it's typically lack of mobility that you're typically going to see as the main cause. The best way for nursing homes to prevent bed sores from being developed is just making sure that they've got enough staff and qualified staff to provide the appropriate care. We've seen some cases of bed sores, and this is of course in the most poorly run facilities, where a person is laying in their feces or laying in their urine for a prolonged period of time without their being changed or the sheets being changed. Obviously, that increases the risk of bed sores, and if somebody already has a breakdown in the skin that's begun, as you can imagine, laying in urine or laying in your feces is only going to increase that problem and lead to other health issues. Well, they're ranked or graded just like you would think of a cancer diagnosis. It's stage 1 to stage 4. And just as is the case with cancer, stage 1 tends to be the least severe bed sore. Stage 4 is the worst. I mean, typically at stage 4, you're seeing a wound that goes down to the bone. And they can often be misleading. You can see the wound on the outside of the body, and it may be something that catches your attention. You think, well, that doesn't look good. But a lot of times the real damage or the real injury is underneath the skin level, where the tissue has just basically degraded and deteriorated, and you can find these pretty significant holes or injuries with the most severe bed sore injuries. With an elderly patient, and particularly if there are other health issues that they're already experiencing, if they develop what is essentially this large infection, then obviously it can lead to death, and has certainly resulted in a number of deaths. Well, the first thing, of course, is to get medical attention. If you're concerned that they're not getting appropriate medical care at the facility, if you need to bring somebody in, maybe a doctor that's not affiliated with the facility, or get them to the appropriate place for treatment. But the second thing that I would urge anyone who has a loved one that's experienced this type of an injury is to contact our law firm. The screening of a case is always free. There's no charge to consult with us. You can call us at 843-554 3100. Visit our website, joylawfirm.com, if you need to get more information about us. But these are serious injuries, and so if you've got a loved one that has sustained this type of injury, doesn't always mean that somebody has done something wrong, but I think you owe it to your loved one and to yourselves to at least have it investigated.